Hi, my name is Janelle Friesen. I'm the Public Information Officer with the UG Public Health Department. It is April 29th, and this is our weekly COVID update. I'm here with Bob, who's been on here a couple of times before, but Bob, do you want to say hi?
Sure. Good morning, Janelle. It's great to see everybody. I'm your COVID-19 vaccine operations director, and it's great to have this chance to chat about what we're doing.
All right, great. Glad to have you back on here. So there's some confusion we've been hearing a lot lately about COVID vaccines that I'm hoping we can clear up today. So we've been getting more and more questions about whether it costs something to get vaccinated or whether you have to have health insurance or anything like that. Can you help provide some clarity on that?
I guess to be most clear, the COVID vaccine is absolutely free. No strings attached, no drama. Anyone who comes into one of our sites will receive the vaccination, and we will not ask you for any money. We will not ask you for any health insurance. It's just there. Now, there are some places in the community, primarily pharmacies, where they will ask for insurance in order to recover an administration fee. At the local health departments, we don't do that. So the easiest way to get vaccinated in the entire Kansas City metro, quite frankly, is to come to one of our sites in Wyandotte County, and we'll take care of you.
Great, thank you for clearing that up. But again, there are other places that provide vaccines and they may just be asking for that to recover their own costs, but you should be able to access a vaccine somewhere in our community, regardless of whether you have health insurance and without having to pay. So.
Yes, ma'am.
All right, great. Just want to make it crystal clear because I don't want people to feel like that's a barrier to getting the vaccine.
Everything we've done has been to reduce those barriers. Everything from where we've opened to making sure that we're on bus lines to making sure that we're open at different times of day. We are committed to reducing any barrier possible in order to improve the public health of the community.
Speaking of reducing barriers, we recently removed some barriers in eligibility. Do you want to give the latest on who can get vaccinated at our sites?
Certainly. Anyone who is 16 years of age or older, regardless of where they live or work, is eligible to receive a vaccine in Wyandotte County. Right now, we have our 3 sites that are open at the Armory, at 20th and 20th Street, right off of the 18th Street Expressway by I-70, at the old Kmart at 78th and State, and at the Best Buy, the old Best Buy at 105th and Parallel Parkway. If you've got an ID, we will absolutely use it to make sure that we've spelled your name correctly, to make sure that we've got your birth date recorded correctly. But if you don't have an ID, it is not a requirement to get vaccinated. If you want to protect yourself against this disease, we will give you the vaccine as long as you're 16 years of age or older.
Great. All right. So we hope that anybody who maybe hasn't had a chance to get vaccinated yet or has been kind of waiting to see, as more people in our community get vaccinated, that they know they can come on through now, no matter where they live. So we've talked a lot about people coming to our sites for vaccinations and how that works. That's what most people are talking about. But what about COVID testing? That's something that we still do see COVID cases in our area. We still need to kind of be able to track that. So how does that work in Wyandotte County at our sites?
So for testing right now, we are doing saliva-based testing at all 3 of our sites. So if an individual is getting ready to go on a trip or has just returned from a trip and wants to make sure that they're healthy, either in order to take that opportunity or to make sure that they're good coming home from it, we'll do that test for you. Like the COVID vaccine, it's completely free of charge. We're not going to ask you for any money, nor are we going to ask you for insurance. We're just going to give you the test and give you the opportunity to provide a saliva sample, and then we will give you back the results. It is still important if you have symptoms to come in and get tested. If you are feeling that lethargy, if you have lost that sense of taste or smell, please come in and get tested. It helps us to safeguard the rest of the community. And finally, if you just want to give us an idea as to kind of how the community is doing across the board, that allows us to look for the variants that are out there where asymptomatic people may be carrying them. And we can do that testing for you as well. Again, there's no need to give money. There's no need for a insurance card. We will just give you the test and provide you with the results in a professional, quick manner.
All right, great. So we can't assume it's just the cold or allergies. We still gotta keep an eye out for COVID, or if you were hanging out with a friend and then they found out they had COVID, still important to get that test. Um, yeah, and then just tracking it in general, like you mentioned. I'm glad you talked about that, because even for folks who may be asymptomatic, they still could be carrying it and potentially spreading it to others.
Absolutely. A lot of companies I know give their folks benefits by coming in and getting tested occasionally. So it is a very powerful tool, and it is a part of the solution, along with vaccines and responsible behavior, to help us end the pandemic and get back to a lifestyle that all of us want to embrace, as opposed to having to limit our behaviors.
Yeah, that's I think what everybody's wanting to work toward. Um, well, thank you for clearing up some of the confusion today and giving the latest on vaccines and testing.
Yes, ma'am. Thanks for the opportunity to chat.
All right, we'll see you all next week.
All righty.